Welcome to the first module of Functional Assessment and Intervention. We'll start out with a brief introduction to various forms of functional assessment. Let's begin by reviewing some terms introduced in the assigned reading that will be important throughout this course. There is said to be a functional relation between a behavior and an environmental event if manipulation of that environmental event reliably produces a change in behavior. That is, in colloquial terms, the environmental event in some way causes the behavior. Both antecedents and consequences can have a functional relation with a given behavior. Functional behavior assessment procedures in general are all designed to allow interpretation of why a behavior occurs based on its environmental context. That is, to identify environmental variables that are functionally related to the behavior. We never want to define the cause of a behavior based on its appearance or topography, nor based on hypothetical constructs like personality or variables that cannot be manipulated, like genetics. An indirect assessment is a type of functional behavior assessment. It involves no direct observation of behavior. Instead, you ask someone, either the client or someone close to the client, about perceived correlation between the behavior and different environmental variables. In a direct or descriptive assessment, another type of functional behavior assessment, you do observe the behavior as it occurs in the natural environment, but you don't manipulate any of those variables. This allows you to more objectively determine correlations between the behavior and environmental events, but does not allow you to empirically demonstrate that the behavior and events are functionally related. Finally, a functional analysis is the third category of functional behavior assessment. It's also sometimes called an experimental analysis. It entails direct observation of behavior, while environmental variables are manipulated one at a time, while all other variables are held constant. Each individual category of functional behavior assessment has its pros and cons. This is just a brief summary. Each type of assessment will be discussed in depth in coming weeks. Indirect assessments are cheap and easy to implement, and take very little time in comparison with the other methods. However, they're unreliable in the sense that a given person answering questions may provide completely different answers at another time. Multiple people giving the same indirect assessment to the same person may also come up with different results. Ultimately, these assessments are the least likely to accurately identify a behavior's function. Direct assessments are more likely to identify a behavior's function, but still much less likely than a functional analysis. This is primarily because you can only identify correlation, not causation, since no variables are manipulated. It does, however, allow better determination of how often a behavior occurs than an indirect assessment would. A functional analysis is by far the most valid way to determine a behavior's function, but they take training to learn how to develop and implement effectively. Depending on the topography of the behavior and what variables might be affecting it, they can also be quite time-consuming and labor-intensive. Hanley et al. In 2012 suggests that all three general categories of functional behavior assessment should be used in pursuit of determining a behavior's function. If you use only an indirect assessment, even if the results appear to be very clear and differentiated, there is nonetheless a high likelihood that the results will not be valid. Structured and closed-ended assessments are also fairly limiting. You may not think to ask about unique variables that occur in the client's environment. If you only use a direct assessment, you may incorrectly conclude that behavior is functionally related to variables that actually tend to follow all behavior. Alternately, you may never see the behavior occur if others in the client's environment have been good at avoiding, evoking, or occasioning the behavior. Finally, a functional analysis performed without first conducting some degree of indirect and direct assessment will have completely arbitrary experimental conditions. Yes, we want to determine whether behavior is maintained by social positive versus social negative versus automatic reinforcement, but what are the actual environmental variables that are more or less likely to precede or follow behavior in the client's natural environment? Why go through the process of a functional assessment in the first place? Once you learn about the many different types of interventions often used by behavior analysts, it may be tempting to simply use one that you've seen be effective in the past. To put it simply, function-based interventions are more consistently effective than arbitrarily selected interventions. An intervention that was effective with one person's behavior may not be effective with another's, depending on what the function of the behavior is. It's impossible to tell, based on the topography of behavior alone, what environmental variables are functionally affecting that behavior. As discussed in the assigned reading, early studies of self-injurious behavior quickly revealed that the behavior across individuals could be influenced by attention, escape from demands, sensory stimulation, or any number of other variables. Aside from effective intervention obviously being more valuable to our clients, performing a good analysis first that reliably leads us to a useful intervention takes much less time than trying a sequence of different interventions that may or may not be effective. Here are some data indicating the effectiveness of function-based and arbitrary interventions, published in behavior analytic journals. In the first column, a function of behavior is listed. Then, interventions are divided into function-based and arbitrary categories. In the third column, you can see the number of different treatments in each category that were found in this literature review. Then, the number of times those treatments were written about in different articles. Finally, the percentage of times that the given category of intervention was actually effective in affecting behavior. As you can see, arbitrary interventions are sometimes effective. However, you have a higher likelihood of identifying an effective intervention after first identifying the function of a behavior. Bear in mind as well that if a function-based intervention is not effective, it may be due to low treatment integrity, manipulations of antecedents but not consequences or vice versa, or other variables. In previous courses, you've reviewed different types of reinforcement, specifically positive and negative reinforcement. These types of reinforcement can also occur automatically contingent on behavior or be socially mediated. If you're not sure about the definitions of these types of reinforcement, take a moment to look at your notes or textbook for review. During functional behavior assessment, we want to consider the possibility that behavior could be functionally related to variables falling into any of these categories. A social positive form of reinforcement might be attention in the form of sympathy. A social negative form of reinforcement could be escape from a demand, like being asked to clean your room. Automatic positive reinforcement is reinforcement that is produced by the behavior itself, perhaps the sound made when you snap your fingers. Automatic negative reinforcement is also produced by the behavior itself, but entails the removal of a stimulus, such as a headache being lessened when you press on your temples. Take some time to come up with variables that fall into each category. Note that, as mentioned previously, both antecedents and consequences can be and are functionally related to a given behavior. We focus primarily on identifying what reinforcement maintains behavior, because operant behavior occurs due to consequences that have followed it in the past. Antecedents only make the behavior more or less likely in the moment. However, they're still important to identify. If a behavior is maintained by social negative reinforcement in the form of escaping from a demand or having to clean your room, the antecedent of being asked to clean your room in the first place is also a functionally related variable. As I'm sure you can see, determining what variables affect a behavior out of all of the seemingly infinite possibilities can be a tricky process. Throughout the first half of this course, we'll discuss many procedures used to help you achieve this outcome. During the second half of the course, we'll review an array of interventions that can then be selected based on the function of a behavior.